make the movie exciting, right? So if you think about the Mayo Simulation Center, we kind of do the same thing. So one of the things we do is we try to make realistic situations for people and for doctors and nurses so they can come in and kind of learn about how to be a doctor and how to be a nurse. So sometimes we use actors that come in and play patients or nurses or pretend to have sicknesses or wounds so that the doctors can practice being doctors. So I'm going to walk you around and show you all the different rooms at the Mayo Simulation Center. And then I'm going to show you a little demonstration about some special effects makeup that we do here. Sound good? Yeah? Okay, thumbs up. All right, here we go. Now, let me show you my videographer, Cody. Cody is here. He is the one taking the video today and helping me do this tour. Thank you, Cody. All right, come this way. Okay, so we're walking down the hallway. You see the big yellow sign here that says Learning Center. This is a big room where we can put up to 60 people and they can attend a class or have a conversation or a meeting. So that's a big meeting room. I'll show you that in a minute. So this is our Procedural Skills Lab. So what happens in here is we allow doctors to come in and practice procedures on either animal parts, or sometimes we have people that will donate their body to science, and we will actually let them look at the anatomy and the structure of people's bodies by looking at cadavers, which is another word for a dead body. There aren't any dead bodies in here right now. You're okay. But this is the place where we go and do those types of things. You'll see all the cameras on the ceiling. We've got all these different ways that doctors can look and see the routing. They can see inside the scopes. They can see all the things that are going on. So this is a really big lab. This is Charlene. She is our Procedural Skills Lab manager. She is the one that runs all the stuff in here and makes sure that everybody has what they need. Here, I'll show you the instrument supply closet over here. Come look. So this room is full of all types of equipment that we use in the lab. All of our tools are over here that we use for different surgeries or different procedures. They're all sorted and organized thanks to wonderful Charlene. And we have all sorts of machines in here for x-ray, for scopes, just a bunch of different machines that people use that show them, inside the body or can do different procedures on the body so doctors can learn how to be better doctors and surgeons. All right, let's go down here a little bit. This place is very busy today, so I apologize. Now, one of the things we do here that you guys might be interested in is we do a lot of 3D printing. I hear you guys do some 3D printing over there sometimes, right? So right now, we actually are using this 3D printer up in here. It's actually going to be printing an item. So we can program it to print different things. For instance, this is something we printed on our 3D printer. That is a trachea, which is your throat right here, like this. See this? It's your throat. So we use that when we're training people about how to help people breathe better. So tracheas, and that's printed on a 3D printer. It's made of hard material. So that's something that this machine here created. And we use it to create all sorts of things, hearts. We do brain pieces. We do bones. Cody, do you have that bone? Where's the picture of the piece of bone? We'll show it to him at the end. We've got a little piece of bone that we printed at one point too. So let me show you the rest of these rooms. So this is our big learning room in here. I'm gonna let you peek in real quick. This is where we do big meetings. Remember I was telling you about actors? This is one of our actors right here. This is Kat. She's actually playing one of our actors today. She's going to be in a scenario later today. And then this room, as you can see, is huge. We can fit a lot of people in here for a meeting. Doing a virtual tour for a summer camp. Oh, lovely. All right, let's keep looking at the center. So as we come back down this hallway, we're going to go into an area that has rooms that look just like hospital rooms. So when doctors come in and they want to know what an emergency room looks like, I'll show you what that looks like. Come this way. So this represents one of our emergency rooms. You see this? This is a mannequin. He will talk, he will breathe, he will blink. You can make him pass out, you can make him sleep, you can make him do all sorts of things. So when we don't want to use an actor Say somebody needs to do CPR, right? We're not going to do that on a live person. So we use our mannequins to do that. So this is one of the high-tech mannequins that we use for that. It's controlled from the control booth over here by our techs. And these are like the screens you'll see in the hospital when somebody has their vitals up to show you how fast your heart is breathing. How much oxygen are you getting? What is your blood pressure? What is your heart rhythm? Certain heart rhythms are dangerous, and you can tell by looking on the ECG lead what somebody's heart rhythm is. If you look here, I'm touching all the buttons and it's turning on all the vitals. So you can see this person's heart rate is at 70, almost 80 beats a minute. That's pretty normal. 98% oxygen saturation, which means they're getting enough oxygen. This is how their pulse, like you can feel your pulse in your wrist, right? And then how many breaths they're taking every minute. So that's kind of the way we track vitals. If you've ever been to a doctor's appointment, you probably know what one of these rooms is. This is an exam room. This is where you would come and sit on the couch and you would have an examination with the doctor. There's the exam table over here. The doctor would sit and do his conversation with you, trying to figure out why you don't feel well. This is like an exam room for a hospital, right? Okay, let's keep going down here. This is another room that we use here. This is a big debrief room right here. People can sit in. They have a nice view. There's a screen up here. If you look around the corner, the doctor right now is giving a lecture on ultrasound. So there's a doctor in here teaching some doctors right now about ultrasound, which is when they look at your body with sound waves, right?
Haley, if you have a good grasp of how we're divided.
All right, I'll show you this room. Okay, so this is like an ICU room, which is an intensive care unit. When you're really, really sick, you'll go to the ICU, and this is the bed here. We're going to have a patient in there later today pretending to be sick. Again, you've got her vitals up here. You've got the chairs. You've got all the things that a nurse or doctor is going to see when they come into the hospital in an ICU room. So that's the ICU room. Let me show you the operating room. So when you go to have an operation, you'll be in a place that's operating room. This looks like the operating rooms at Mayo Clinic. So you would be on the bed with the doctor here. We've got the anesthesia machine, which is anesthesia doctors or doctors that help you go to sleep so you don't feel any pain during an operation. So they can give you medicine so that you continue to breathe and all the different things. This is for x-ray work. So if you come in and you need to get an x-ray, say you've broken a bone or you think you might have broken a bone, they'll come and take pictures of you with this machine here so you can get well. They can put a cast on you or decide if you need surgery or whatever you might need. So this is a good example of an operating room. I'm going to show you the back hallway. Now, not everybody gets to see this. So it takes a lot of equipment and a lot of things to make this place run. So this back hallway holds all of our equipment that we use to run all of our courses. You'll see we've got a bunch of IVs over here, poles with fluid, pressure bags that help that fluid flow through the tubing into your body if you're getting fluids, right? When you get real sick, sometimes they'll give you fluid. We have all sorts of trainers here. Say you want to learn how to sew somebody up. You get a really bad cut. We have these kits that let you learn how to sew together a cut. So each of these things here represents a special kind of cut or a laceration. And the doctors learn how to use special tools to sew you back up. So we make kits for them that they can take home and practice if they want to learn how to suture. Suture is a fancy word for sewing, right? Okay, let's see what else we have here. So there are different machines that are going to be in the hospital. One of them is called a respirator, a ventilator. It'll help you breathe. So there's different machines here that we can practice on so the doctors can learn how to help somebody breathe. Somebody might have to put this mask on to help them breathe. That's called a BiPAP mask. You're really having trouble getting oxygen, we can hook this up to you and help you breathe. If you're looking down somebody's throat, this is called a glide scope. So this helps doctors look down into your throat to see if there's something going on with your airway or your breath so that you can breathe better. Now, I know you'll think this is fun. This is our birthing mannequin. So when we want to pretend like somebody's having a baby, we have this mannequin here. Her name is Victoria. Here's her face. But if you look inside here, you can open up her belly and we can put a baby in here and then we can have doctors practice delivering a baby. So we do all sorts of stuff here. We do deliveries, we do lacerations, we do anything that you're going to do or learn as a doctor or a nurse, we can train you on here at the Sim Center. Back here behind you, you'll see a bunch of big blue pieces of equipment. These are movers or moving equipment. So if somebody is unable to get out of their bed, they've had surgery or they're sick or they just don't want to move because they're afraid they might fall, we use these different pieces of equipment for them to be able to move and be moved safely. So these are called movers. So we train nurses on how to safely handle the patients. So one of the things I wanted to show you guys today is what I think you all are interested in seeing, which is how do we make fake wounds and how do we make things look realistic for the doctors? One of the things we do is we make fake skin. So do you see this? This is fake skin. So we can cut it, it'll stretch. We can use it to put wounds on, put dressings on, all sorts of stuff. So one of the things I'm going to show you today is called moulage. Moulage means medical special effects makeup. So if I want to make it look like somebody has gotten some metal in their skin because they got hit by a bomb, we have things like this. Do you see that? It looks like somebody got pierced by a sharp piece of metal and it went into their skin. So these are the kind of things we make. Let me show you how this is put together. So we took a wound and we painted it on the inside to make it look bloody. You see that? Then we stuck this piece of plastic into it so it looks like a shrapnel wound. Shrapnel is when bombs or large pieces of metal explode and all the little pieces of metal shoot out and they can injure you or hurt you. So that's a shrapnel wound right there. One of the things I was going to show you was how do you make it look like somebody has been burned? A lot of times you'll get people into the simulation center that want to practice how to treat someone with a burn. So I'm going to just show you on myself here. So if I want to look like I've been burned, I'm going to take some red makeup, just like some blush right here. And I'm going to put it on my arm and I'm going to just spread it around until it looks the right color for the burn I want it to be. So how burned are you? Well, there's first degree burn, which is just when you're really, really burned like that, right? So that almost looks like a sunburn, right? So there's a first degree burn. If you want it to look like somebody has some blisters on their skin, like a second degree burn, which is when your skin starts to blister, we can take these little balls of wax. This is called nose and scar wax. So you can roll this stuff up. It's almost like clay or Play-Doh. You could push it onto your skin and you could make it look like suddenly you've got a big blister on your skin now. Oh, look at that. I got burned and now my skin's bubbling up and I have a blister. So we have all these different props to do that. I was going to show you guys how to do a cut. You want to see how we make a fake cut on somebody's finger? I'll show you. All right, we're going to do it on this skin right here so you can see it better, so Cody can get a better angle. So the first thing, if this was somebody's arm right here, this piece of skin was somebody's arm, I'm going to take some of this wax right here. I'm going to roll it into almost like a little worm. You see how this is rolled into a little worm? And I would press it onto their skin like this. I'm using just a big popsicle stick. You see that? It's just a big popsicle stick. We call them tongue depressors here, right? So we kind of press it onto their skin. And then what I will do is I'll take this real skinny stick here and I'm going to push it into that clay because it's going to make like a dent in the middle of the clay for me, okay? You can't see it, but you will in a minute. Then what I do is I take some of that red makeup again and I start to color it so it looks like a cut. So I can make this on this skin and then I can put it onto myself. I'll show you. One of the things that makes a cut look realistic is when you've got dark color inside of it. So I take this palette here. You see the three different colors? We've got blue, black, and red. So I'm going to take a little bit of brown right here, and I'm going to do just a little bit into the wound there to make it look like it's really cut bad, right? So here we are doing this cut right here. Now, what really makes it look scary is when you put it onto your skin and put some fake blood on it. So I'm going to show you that right now. So once I've made this wound, I can pull it up off of this fake skin. See that? And now I can push it onto my hand. And I can blend this stuff into my hand to make it look like it's on me, like I've got a bad cut on my hand, right? So you're starting to see how that starts to look real, right? You push that cut right there in the middle. Get a little more brown in there to make it look like it's really a deep cut. When you put brown in there, it gives it depth, so it makes it look like a really deep cut. And then if you really want it to look realistic, you put some fake blood on it. Look at this. So now it looks like I have a bloody fake cut on my hand. Do you see that? Gross, right? Yeah, kind of makes a big mess. But that's part of the fun, is you're trying to teach people how to make things look as realistic as possible, even if it's a gross, bloody mess on your hand, right? So I'm going to put that away so you guys don't have to see that. Now, I know we always have questions on these tours, so I'm going to give you guys the last few minutes. If you want to ask any questions, you can type them into the chat, or your teacher can relay the questions to me. You can ask me anything you want to know about what you've seen today. Anybody have any questions? Teacher, can you help? What's a good question?
Yes, ma'am. Anybody have a question? Yeah, you can grab the microphone. Yes, a question? Yes. Who has a question? And then you can grab the mic.
The question is, when people do the cut, actors, do they really just put the skin on most of the time, or do they really just put it on their hand instead?
They will, most of the time, I'll make it on the skin just so that it doesn't get them messy. And then I'll pick it up off the skin and put it onto their arm, so that once I get it onto them, it's almost done, except for the fake blood part, so that it's going to get the skin messy while I'm making it. And then when I actually take the actual cut that I made and put it on the skin, then it's all ready to go. And it looks like a real cut. Good question. Go ahead.
How do you make the mannequins look more real?
Oh, that's a very good question. So some of the things we do to make mannequins look more real is, if we want the mannequin to look older, we'll put a gray wig on the mannequin. If we want them to look like they're pregnant, we have fake bellies we can put up under their skin, or we can use the birthing mannequin over here. Their eyes will blink, and you can listen to their vital signs. Vital signs is like, how fast are you breathing? How fast is your heart beating? Are you healthy? So what makes them realistic is doctors can use real stethoscopes to listen to those mannequins and hear their breath and their breathing and their heart rate. So it's a combination of what they see as well as what they hear and can feel. Good question.
Birthing mannequins, they were like,
Wait, I can't hear you. What was your question?
How does that birthing mannequin work? Is it like a
Okay, so we'll walk over here and I'll show you. This is always a big question. Let me grab it. So, you see this? This is a fake baby, right? So this looks a lot like the mannequin the baby that we would use for Victoria. This isn't the one that actually goes inside of her, but the one that goes inside of her will wrap up and go down into her like this, and then she's birthed. So we can control this mannequin. We can make her push the baby out. We can make her talk if she's in pain. We can make her ask questions. We can make the baby's heart rate go faster. We can make the baby seem like he's sick, so that the doctors are helping the baby get born safely. So this is a little mannequin they use where they can do compressions. You see what I'm doing here? For babies, that's how you give compressions. You just use 2 thumbs and you help their heart beat if their heart stops beating. So these are one of the mannequins they can train on if they want to learn how to take care of a baby. Good question. Next question.
Go.
How do you make what?
How do you make it? How do you make everything work?
How do you make all the mannequins work? Is that what you mean? Okay. So the mannequins are run by electricity, just like your TV or your microwave or all the equipment at your house. They run on electricity and they talk to computers. And I can show you one of those computers that we use to run the mannequins. Let's go back here into this control room right here. So this is one of the computers we use to run the mannequin. So you might not be able to see this very well, but you can run his heart rate. This, you can open and close his eyes. You can tell him how fast to make the heartbeat. And if you look through this window here, you'll see one of our patients getting ready to be a sick patient. This is Kathy. She's one of our actresses. She's going to play somebody who has a blood pressure issue today. So she's going to be in the room and the nurses and doctors are going to take care of her. These are the chairs. This is like the control room where all the technical and important stuff happens. We can make people see different rooms by looking at this panel here. You can see all the different views and all the different rooms. You can swap the rooms up and look at different rooms if you want to. See all the nurses getting ready to be learned right now. Look at all those nurses in there. All right, next question.
Third degree burn look like?
Say that again.
What does a third degree burn look like?
I can't understand him.
What does a third degree burn look like?
What does a third degree burn look like?
Are you talking about
burn? Yeah, third degree
a burn?
burn.
Different types of burns. Okay. So when you have a 3rd degree burn, your skin actually starts to just peel away. It starts to peel away in layers. Kind of like when you see an onion, you peel the different layers, your skin will start to melt. Those are harder to do with makeup, but they can be done. If you look over here, this is what we call our PAR. This is where we have all of our medical supplies, all the different types of bandages, needles, containers, tubing that doctors and nurses use while they're in the hospital. We have all those supplies back here for them to see. Some of these things are things that we use when we're doing different scenarios. So, and sometimes we'll use this to do burns. We'll get a bandage and put a bandage over the burn for the doctors. Any other questions?
In what stage of medical training do you give this? Like, is it for med school students?
That's a good
or
question. Yeah, we train everybody. The simulation center trains everybody from hospitality workers all the way up to brain surgeons. So it's a wide variety of people we train. Our biggest client that we train here are nurses. In fact, we've got a bunch of nurses here today that are learning, about 50 of them here today. So we train nurses fresh out of nursing school. We train doctors that do surgery. We train doctors that are good for hearts. We train doctors that work in the intensive care unit. We train doctors that operate on brains. We train doctors that fix bones. Any type of medical thing you can think of, we train them here. Any other questions?
Is this like an optional training that they take after they finish their medicine? Because not every place has all these facilities, right?
No, certain doctors and nurses are required to maintain their certification, which means if you're going to continue to be a doctor or a nurse, you have to take this course so that we know you're doing everything correctly in the hospital room. So throughout their whole career, they're required to come here and do training. Sometimes it's optional. If they just want to learn something, they can come in and work in one of our rooms on some of our trainers. But most of the time, it's not optional. They have to come in and learn these things so that they can continue to be doctors and nurses.
We have a lot of students here whose parents are doctors. Can you all raise your hand? How many? 1, 2, 3, 4, 5.
Want to be doctors?
Whose parents are doctors?
Oh, parents are doctors. So you probably could have given this tour. Excellent. Any other questions?
Any other questions? Anybody else? You have a question?
And Coach K, you can always, if you have questions after the fact, if you want to email them to me, I can answer them after the fact as well, if you'd like.
Sure.
Go ahead.
You have baby actors?
We don't. All of our actors that work here have to be 18 years of age to work here at the Sim Center. You have to be a legal adult. So we use mannequins for babies. If we need baby actors, we use our mannequins or our fake babies.
Today, are you allowed to show us one of the mannequins talking?
Sure, I can show you a mannequin talking. Come on.
Are you ready to see mannequins talk?
We'll span it so they can see all of them.
Anybody in there right now? Michael, will you run through a demonstration for me of all the different sounds that you make? Talking, sneezing, screaming. Oh, he's not working? Okay. We're having issue with our connection right now on our mannequin, so I don't think I'm gonna be able to show you what he says and does, but I can send your coach a little video of something that he does that she can play for you later.
He's breathing though. You
We're
can
trying to
see.
get it, but if you look over here, you can see that he's breathing. Let me show you.
And he's blinking.
Watch. See how my hand is rising and falling on his chest? So he's breathing. If you see his eyes blinking, now he's beeping. It looks like he's working now. Maybe Michael will make him scream for me. Hold on.
I can't see you.
Maybe the camera angle. Yeah.
You hear that scream? He just screamed real loud. We can make him cough and throw up too. Michael, can you do one of the vomiting ones, the coughing ones?
They want to.
Hear him coughing? So if he's got a bad cough or something, that's what we can make him do. You hear that? There you go. All right, guys. Anything else?
Yeah.
He's making throw up noises now. You hear that? Isn't that gross? Yeah, it's nasty, right? Ugh. Go ahead.
Do you put makeup on the mannequin to make it look more human?
Sometimes we do, but their skin is very special and sometimes it's hard to get clean. So if we don't have to put makeup on them, we don't, but yes, we can. We usually save the makeup for our actors because skin is much easier to clean than silicone. That makes sense. Anybody else?
Yes.
All right, one more question.
What is the texture of the skin?
Say that again?
What's the texture of the skin?
Can't hear him.
What is the texture of the skin?
Oh, the texture of the skin. So it's very much like silicone. So like plastic. If you look here, down just a little, you can see that you can pinch it just like skin. It's like that fake skin I showed you during the moulage. So it's all silicone. It's made of a special material that is water resistant and that we can see, look, he's got a fake IV in his arm. When you go to the doctor, sometimes they put IVs in you, right? So they can get fluid into you or give you medicine. So we even have fake little bandages on him here for IVs. But his silicone is mainly what he's made of, a special kind of plastic. Say that again?
You have some more baby mannequins?
No, I don't have any. Well, you know, we don't have them out right now. Another department is using them. So I showed you one, but I don't have any other baby mannequins I could show you right now. I'm sorry.
Again, you're all saying a big thank you.
You're so welcome. And if your coach wants to send me any additional questions, I will write back to her and give her the answers.
Sure. So one more question.
Oh.
Can twins be born with a mannequin?
Say,
Can twins be born with a birthday mannequin?
can they do what with mannequins?
Can twins be born with a birthday mannequin?
No, that's a very good question. We do not have a setup to birth twins from the mannequin, only one at a time. For now, we might get one eventually that'll birth two, but right now it's one baby at a time.
Thank you so much for making time for us and giving us a live tour. And again, in the following 2 weeks, I'll see you again with another set of students.
Yeah, we'll see you next time. Thank you
very much.
guys. Have a good day.
Bye-bye.
Okay.